Having me. Matt, can you give me a thumbs up if you can hear me properly? Okay, awesome. So as Matt mentioned, my topic today is going to be talking to you about scheduling. And I think one of the reasons Matt might have invited me to do this is because when I was a chief resident at Cincinnati, hold on, I got to figure out how to advance my slides. There we go. When I was a chief resident at Cincinnati, which was only 4 years ago, so this is pretty fresh in my mind, we had just recently started using a program called Shift Admin. And so I got really, really interested in scheduling then. I became a little bit of a scheduling nerd, and I have remained a scheduling nerd since that time. As he mentioned, I work at Henry Ford Hospital, and I am obsessed with scheduling. And one of the things that I recently did was I brought Henry Ford, our faculty group, on to scheduling with Shift Admin after using a template schedule by hand for many, many years. And to echo what Dr. Davis said, change does not happen overnight. It was probably a 2-year campaign on my part. But so I'm really into scheduling. I think it's really important in terms of how it affects physician wellness. And as chiefs, it's going to be one of the things that your residents will remember you by. Did you put a lot of effort into their schedule and do your best to listen to their concerns and create schedules that were aligned with wellness, or did you put schedules out that made people's lives more difficult? So that's my dog, Frank, by the way. That's why there's a random picture of a pug. So what I wanted to do just to start was to ask you how you make your schedule. I'm going to back out of this just for a second because I want to be able to see the chat. Because I'm not going to talk specifically about how different schedules are made, meaning I'm not going to show you how to set up an Excel spreadsheet to create a schedule by hand, but I am curious to know what you guys use. So do you use computer scheduling? Do you use an Excel spreadsheet? Is it a template? Are you using Tangier Shift Admin? Give me an idea about what you're doing. Shift Admin, sad face. Wow, a lot of people on Shift Admin. Okay. Some Excel. QGenda, another common one. I haven't heard of MedRes before. This is a new one for me. I'm assuming that's some computer generated. Double check with Excel. Template Excel sheet, upload to software starting QGenda this year. Okay, cool. So it kind of looks like the vast majority of people are doing some form of electronic scheduling. It looks like some people are probably using Shift Admin to generate schedules, and then some people are doing it manually and then just using Shift Admin as a way to display them. Okay, cool. So I am happy later on to field questions about Shift Admin offline, since we won't be talking about it a ton here, but I saw some Shift Admin help in there, and I love Shift Admin, so I'm happy to kind of touch base on that. So why should you care about scheduling? Well, I'm going to touch on this article a few times. This is an article that came out in 2018 in AEM, Education and Training. And basically, they looked at 140-ish residents at 4 different residency programs and asked them what they value in a clinical schedule. And above all else, the thing they agreed upon was that their schedule was one of the main things that factored into their overall wellness when they were on an EM rotation. So 98% of them said that was the most important thing, one of the most important things that affected their wellness. So you guys as schedule makers are going to have a huge hand in the wellness of your residents. So that's why this is so important. So what are we going to talk about today? Preparation is key. We're going to talk a lot about preparation because preparation makes or breaks your scheduling process. If you prepare well, it's going to be smooth sailing. If you skimp on preparation, you're going to be mired in trouble. Know the rules. We're going to talk about duty hours because that's super important. I'm going to talk a little bit about like theory and concepts around making a schedule. So not the nitty gritty parts of Shift Admin or the scheduling process you're using, but what are the sort of theories behind how shifts should be laid out in a schedule. I'm going to talk about my process for checking a schedule, what I look for, what my hard stops are, what my soft stops are, that kind of thing. And then we're going to talk a little bit about taking feedback gracefully, okay? So if I can impart anything on you, it's give yourself plenty of time. It seems like a schedule is a quick thing that you could whip together, but I'll tell you that in general, it took me probably between 6 and 7 days between the creation of the schedule, which takes about 2 to 3 days, and then checking the schedule itself, which takes about 2 to 3 days. And that's just the making of the schedule. That doesn't include any of the preparation time. So start early and give yourself more time than you think you need, especially at the beginning. So I'm going to give you a brief timeline. This is basically what we followed in residency. Yours may be different depending on the length of the blocks that you're scheduling, but assuming you're scheduling on a month-to-month basis and you're releasing your schedules 2 months before the start of the block, this is kind of how we approached it. So we did a lot of prep at the beginning of the academic year, and I'm going to talk a little bit about that in a minute. 1 month before schedule release was when we collected schedule requests. We confirmed the dates of our rotating residents, and then we collected the important dates from the residency program that we needed to keep in mind for that block. And then 2 weeks before schedule release was when we would create and check the schedule and then release the schedule to the group. All right, so this is the part where you're at right now, which is preparation at the start of the year. So the first thing you need to do is gather information about rotating residents for the year. So introduce yourselves to the residency administrators and coordinators that are responsible for the schedules of the rotating residents. Get to know them, give them your contact information, and get their best contact information. You're going to want to get block schedules from them and also understand their scheduling expectations. So some of your rotators may have to attend clinic while they're on their EM rotation. Some may have vacation time. You need to figure out how many shifts they're expected to be scheduled and find out what their educational objectives are. So that's all information you want to get at the beginning of the year so that you can plan, okay? Then you need to get the block schedule of your residents as well so that you can kind of see the layout of who's in the emergency department at a given time and know what shifts you'll be responsible for scheduling. So you may rotate through multiple clinical sites. Maybe you have a pediatric site, maybe you have a community site. You need to know what shift your residents fill and on what days, and know which ones you're responsible for filling so that you know what a full schedule looks like for you. Finally, this is the time to negotiate any changes that might be needed to even out your coverage. So this is complicated, but as you get block schedules for your rotators and for your own residents, you may find that there are months where you're really overstaffed and months where you're relatively understaffed. There's some limitations in the amount of leeway you have with asking rotating residents to move, but it's worth asking. If you can even out your schedule right now, it's going to make it much easier for you to cover your shifts later on. And also it'll prevent the sort of surplus of residents that you get in different months that can dilute the educational experience because you have all these rotators and there's not enough patients for everyone to see. So make sure that you take this opportunity now to reach out, see if they have any leeway, and try to even out your coverage over the year. Last thing is you need to know who needs access to your schedule. So it's not just your residents, right? Off-service administrators for the rotators that are going to be coming and spending time with you, they need to know the schedule. The administrators at your other clinical sites, your community shops, your pediatric shops, they're going to want to know who's coming and when. Your residency leadership obviously needs to know the schedule, and your residents. You need to know who needs to know those schedules and when do they need to know them by. Create a timeline for when you're going to start working on and release each schedule. I can tell you one of the questions that will probably start to irk you as your chief is, hey, when is that schedule coming out? Hey, did you do that schedule yet? When am I getting my schedule? One way that you can combat that is by creating a timeline and letting the residents know ahead of time when they can expect their schedule. Occasionally, we did run late and we tried to be very transparent about why that was happening. But if you can give people a timeline, it tends to mitigate some of those questions so that they know when to expect. All right. Also, Matt, I can monitor the chat just from presenting. So if you see anything come up and you want to hop in, just let me know. If you guys have questions, feel free to interrupt me or put them in the chat. All right. So we've done all your prep for the beginning of the year. You know who's coming in when. You've evened out your schedule. You've got contact information, and you've set up a timeline. So now you're starting on your first schedule. So here's what you need to do. Reconfirm your rotating residents and their scheduling limitations. Things do change throughout the year, and those administrators and coordinators don't always remember to tell you, hey, so-and-so, Dr. Brown was going to be coming to the emergency medicine rotation, but actually we had to pull him to this other thing. So reconfirm, double check that you know who's coming and that they're still coming. And then get their contact information. You need to know what phone number you're going to be calling if you need to wake them up because they forgot to come in for a shift. And then also to let them know if their schedule changes at the last minute. And then give them your contact information so that they know how to contact you if they have an issue once the schedule comes out. Because remember, you're just not creating the schedule, you're also administrating the schedule. So when there are issues, if somebody doesn't show up, you're going to be responsible for contacting that person and making sure that they know what their schedule is. So you need to gather some information for each schedule. Which residents will be in the ED and which residents will be off service, who's on vacation and when, what is each resident coming from, and what is each resident going to after the schedule. This applies both to your rotating residents and emergency medicine residents. This was the area that plagued us most, because if we were not careful about noting, hey, this person's coming off call in the ICU, or this person is coming off the night rotation that they have with orthopedic surgery, and we put them on a day shift on the first day of our block, that was our problem, and we needed to fix that. And that's not an easy fix once the schedule comes out. So make sure you know where they're coming from and what that schedule looks like. If you're going to collect schedule requests, this is the time that you would do that, and we'll talk a little bit more about that later. And then note important dates for residency events and recruitment. So if you have events that certain residents need to be at, if you have in-service exam is a great example of this. If it doesn't coincide with your normal conference day, it's important that you figure out how that schedule is going to be made so that residents are available for those tests. So make sure you know what those dates are and mark them ahead of time. I'm going to give you an example of what I did. This is an actual picture of one of my data collection sheets. So I collated all this information into one space so that I could easily refer to it when I was making a schedule. So we were doing shift admin at this time. This was information that I had available to me as I was putting requests into shift admin for the residents. So you can see I have a column for name and then what rotation they're coming from. So whether they're coming from the ED and what shift they're coming off of, or if they're coming from trauma, CVICU, the dates that they're in the department, and if they have vacation or elective, what they're going to, and then actually for some reason in this one, I'm not sure why, I put the next rotation they're going to after. Those are their requests that they submitted to us. And then my notes are any events from the residency side that I needed to take into account as I made their schedule. I'll give you another example. This one I liked a little bit better because I had divided the month into two halves, because that's kind of how our schedule worked. So you might be on vacation or elective for half of the block. And so that way I was able to see individually what the two halves were, but it's basically the same setup. I would recommend doing something like this that makes sense for you. I saw a lot of you mentioning that you use an Excel spreadsheet as you're either making a schedule or setting up for shift admin. And so this is one of the ways that I did that. Any questions about preparation for scheduling? All right. Like I said, feel free to interrupt me, but we'll keep going. All right, so before you even start to think about a schedule, you need to know the duty hours, respect the duty hours, and commit them to memory. There is no justification at all for violating duty hours. If you can't cover the shifts you need to cover without violating duty hours, you have to talk to your residency leadership. You can't violate them for a schedule request. You can't violate them for a special event. You just can't violate them, okay? So know these and know them well, because not only are you going to be responsible for incorporating them into your schedule design, but you're also going to be responsible for policing the residents who are making trades as they might be trying to put themselves into a duty hours violation. So emergency medicine has different duty hours than other specialties, as you're probably aware, because of the intensity and decision fatigue that comes with working in an ER. So 12 hours max, that's the longest consecutive shift length that you can schedule. Now, obviously, some residents stay overtime for patient care or charting. That's not included in this 12 hours. It's just 12 hours scheduled time in the department. Every resident must have a consecutive period of time off after their shift that equals at minimum 8 hours and must equal the amount of time worked during that shift. So if you work 9-hour shifts, then the resident must have a consecutive 9-hour time period off after each 9-hour shift. Same for 10, et cetera, all down the line. If you have short shifts for some reason, like if you have a 6-hour shift or a 7-hour shift, the minimum amount of time that must be off after that shift is at least 8 hours. Generally, it's good practice to set your minimum time off at 12 hours. You cannot work more than 60 hours of patient care in the ED per week. This is not averaged over the whole block. Every individual week is capped at 60. So it's different than other rotations where there might be an 80 hours per week average. It is 60 hours per week. And in addition, you can't have more than 72 hours of patient care per week. This is particularly applicable if you have residents who are rotating in clinics or have a longitudinal clinic and are also on an EM rotation. You have to take into account the patient care time that they're spending in clinic. Everyone must have a minimum of 1 day, which they sort of clarify as a 24-hour consecutive period free of work every 7 days. So again, this is not averaged over 4 weeks. Every 7-day period must include one 24-hour period that's free of work. Remember, moonlighting does count toward duty hours, and it cannot interfere with your main educational activities. Now, in most cases, I think most of you will not be responsible for scheduling moonlighting, but just be aware that your residents need to know that they cannot take a moonlighting shift that will force them into a duty hours violation. And finally, in general, the same with other duty hours rules, you must have 4 days off from clinical and educational responsibilities per month. So make sure that you know these rules, that you follow them, and they're going to become important when you're checking your schedule as well to ensure that they're not violated as you make your schedule. Any questions about duty hours? Anything popping up in the chat, Matt? Okay. This is all stuff you've been living for the past several years, but probably just may not have known all of the nuts and bolts behind it, but these are the rules. Okay, so we're going to talk a little bit about making the schedule. I'm going to talk to you about best practices for scheduling, but my caveat here is that very likely you're coming from, most of your institutions have a way you've been making schedules for years. So maybe you come from a strict circadian template where you do 6 on and then you have some period of time off and you go back to another 6 on. Maybe you were like a blocked days and blocked nights shift kind of shop. Before you go blowing up the whole schedule and changing it or trying to adopt something you see here that maybe you don't do, you have to get buy-in. You have to talk to your residency leadership team and you have to talk to your fellow residents. So I'm going to present some ideas here, but obviously if it's not in keeping with what you guys are doing, make sure that you talk to some folks before you make big changes. So in general, I recommend keeping the number and type of shift relatively even across residents in the same class. So this applies to any category of shift. You want to keep your percentage of day shifts, swing shifts, and night shifts relatively even across members of a class. If you're a shop that scatters pediatric shifts in with your normal shifts at your regular shop, you'll want to make sure that those are relatively evenly distributed across members of the same class. Both because one source of frustration for residents is finding out that they have 6 shifts at the ped shop and you only have 1. And another source of frustration is being overscheduled on nights, where other people might be relatively underscheduled on nights, things of that nature. So you don't want to tear your hair out over trying to make it perfect, but the closer that you can get to having an even distribution of different types of shifts is going to help in the long run towards your overall zen feeling about making schedules. Use circadian patterns in your shift progression. This is really important. I'm going to talk about this a little bit more in a second, but this is generally accepted practice for shift work, especially for workers who don't work one set shift all the time. Allow residents to make schedule requests. So we're going to talk about this a little bit more later, but this is a pretty important thing for wellness, and I think it's something that is fairly feasible for most residency programs. And then try to give 1 golden weekend per resident per month. Most of us have friends and family who don't work in the medical profession who enjoy weekends off. It's nice to have 1 weekend per block where you can feel like a normal person, like the rest of society, and you have a weekend off. So it's good for wellness, something to consider. All right. So what is circadian shift progression? So you're all probably familiar with your circadian rhythm. That's sort of your natural sleep-wake cycle. And we won't go into a ton of sleep science here, but it will not surprise you to know that I'm a little bit of a sleep science nerd as well. But one thing you should know about human beings is that our circadian rhythm is actually 25 hours long. So if you put me in a cave and you took away all light and all exogenous influences, I would go to sleep about an hour later every successive calendar day. So it's more natural for human beings to go to sleep at a later time each day than it is for us to try to go to sleep at an earlier time each day. And so a circadian shift progression is the thing that feels most natural to us. What does that look like? Your shifts move forward in start time from one day to the next. So here, this example, I have 7 a.m. shift time start that is followed by a 3 p.m. start that's followed by a midnight start. Now, it doesn't have to be one for one, so you could have 2 day shifts followed by 2 swing shifts followed by 2 midnights. But the important thing is that you don't work backwards. So you don't want to be working a 3 p.m. start shift and then come back to a 7 because that's anti-circadian. If there's 1 day off in between, you still would ideally take circadian patterns into account. So say I had 3 day shifts and then I had a day off, or say I had 3 swing shifts and then I had a day off, it would be kind of tough to come back to a day shift afterwards, 3 swings followed by a day. It's not always possible for residents, but it's something to think about as you're scheduling. However, when surveyed, residents rated the ability to request a specific day off and have a full weekend away from work as more important to them than a clockwise shift rotation. So residents were more willing to do something that was anti-circadian if it allowed them to have a specific request or have a full weekend away from work. So keep that in mind. That's why I say I recommend schedule requests, because residents consider this to be really important. And there's certainly a correlation between better wellness and having the ability to develop your social interactions outside of work. And part of that is being able to request time to develop those social interactions. So some best practices around schedule requests: set a firm date, closing date for requests, and stand by it. So schedule requests are due this day. If you get your requests in by this day, we'll consider them. If not, we won't. It seems a little bit draconian, but to be honest, it's important for your sanity to say, hey, this is the cutoff. Give people ample warning, but then stand firm by your cutoff. We use a Google form to collate requests, which I thought was super helpful. You can also, if you're using Shift Admin, if you're using the software to generate schedules, you can have people submit their requests through Shift Admin or through your scheduling software. Those are a couple of suggestions I have. Distinguish between personal and academic requests. So as you move on in your years in residency, you're probably going to take on some research obligations, some teaching obligations. Your residents may need time off or specific days off to teach medical students or to go to a research meeting. So I think it's reasonable to take some of those requests into account. And remind your colleagues, a request for a day off is a request to have someone else work in your place. Use it wisely. We did not limit people to a specific number of requests. We felt our co-residents were responsible enough to manage the volume of the requests, and by and large, they did. We didn't really have an issue with this, but we did remind folks that, that to use them sparingly and really evaluate when they actually needed a day. All right, so let's talk about night shifts. So ACEP actually has a policy statement about night shifts for best practices. It's generally geared towards attending emergency physicians, but I think it's worth touching on so you can understand when you're looking at sleep science, what makes the most sense for night shifts. So the gold standard is dedicated night doctors. So ACEP recommends if you can find somebody who's willing to work all nights for you and that's all they do, so that everyone else cannot be slipping on and off of nights, that's the best possible scenario. If you can't do that, then the recommendation is isolated, infrequent night shifts, meaning no more than 1 night shift at a time, and it doesn't happen that often. Or you do several long blocks of nights. So a long block of nights is actually closer to 1 month of nights, where you go the beginning of that month, and then you get on nights and you stay, and then you don't do it again for the rest of the year. The worst possible approach to night scheduling, as it turns out, is a block of 3 to 6 nights, which ironically, or coincidentally, is what we did in my residency program. And the reason that they don't recommend this is that the first few nights that you're on a night shift schedule, your work performance lags because you're awake when you're normally used to being asleep. You accumulate sleep debt. And then by the time you get to about your 4th or 5th night shift, you're starting to really get comfortable in a nocturnal pattern, and then you're done. So then you spend the next several days trying to readjust to a day shift. You get kind of the worst of both scenarios. Unfortunately, the best practice scheduling recommendations that ACEP recommends don't really work that well for resident scheduling, because in general, residents work a higher number of shifts and have a higher night shift burden than attending physicians. It's just not educationally feasible to put one resident on nights for the whole course of their residency, because obviously they're missing out on educational opportunities. So we don't do that. The other thing is long stretches of night shifts can result in social isolation, which is particularly hard for residents who are working a lot. And a big part of your residency and wellness in residency is being able to connect with one another and spend time together. So that social isolation is a pretty big downside of doing long stretches of night. Residents in general preferred a strategy that limited both the number of circadian adjustments that they must make while avoiding prolonged periods of social isolation. So when you ask residents what they want, really what they want are those short blocks of nights, 3 to 6 nights in a row, where they're not making a number of switches throughout the month, but they're avoiding being on nights for a long period of time so that they're not super isolated. So in summary, for you guys, isolated night shifts are probably impractical. You just have to do too many night shifts in a month. And if you tried to put them one at a time, you'd be flipping back and forth all the time. Long blocks of nights, some programs do something like this. One of the programs that was studied actually did a 2-week block of nights. But you have to take into account that this may increase social isolation. So try to take that into account, see how residents are doing. 1 or 2 shorter blocks of 3 to 6 nights is what's preferred by residents, and honestly, probably the most feasible thing for you, but just keep in mind that it's potentially the most physiologically difficult or detrimental. Regardless of what you decide to do, there's 2 key things I want you to take away from nights. You need to give residents adequate time to switch back to days. Generally, more than 24 hours is needed. So technically, you could end a night shift at 7 a.m. on one day and come back at 7 a.m. the next day for a day shift. That would actually give you that 24-hour time period off that's required by your duty hours. But it doesn't really give that person enough time to really readjust to a day shift. So my recommendation is give them the post-night stay and then 1 full calendar day to adjust. You may not always be able to do that. Schedule requests sometimes get in the way, but keep that in mind. Okay, before I move on, any questions or comments about those concepts, the circadian patterns, schedule requests, evenness, that kind of thing?
That was really news to me. Thanks for sharing. I mean, so far that's really helpful. Thanks, Brittany. So far, no questions in the chat, but keep putting them in the chat otherwise.
Cool. All right. So checking the schedule. The first thing you've got to do when so let's say you've made your schedule, shift admin spit out a schedule at you if you're using the algorithm, or you put your shifts into Excel and you're ready to look it over. The first thing you got to do is look for hard stops. These are critical errors. So make sure you've got a doctor in every single shift. So if you have empty shifts, that's a problem. So make sure you've got every shift filled. Make sure that no doctor is in a shift she's not allowed to work. So you don't want interns in upper level shifts. You don't want your rotators filling shifts at other shops that they don't rotate at. So make sure that everybody's in a shift that they're allowed to work. Ensure that you haven't violated duty hours. This is crucial. If you send a schedule to your program director or one of your APDs that has a duty hours violation in it, it's going to get sent back to you. So don't do it. And make sure that no doctor is double assigned. This is huge. If you accidentally put that resident who's rotating on ortho this month in your schedule, it's going to create 15 to 20 holes in your schedule that you're suddenly going to have to backfill. So make sure, absolutely sure, that everybody that is on your schedule is actually rotating through the department that month. And then mind the edges. As I mentioned before, you really need to know, what is this resident coming from and what are they going to? Best practice, I would say, honestly, is if you have the luxury, give the resident who's coming from an off-service rotation and going to an off-service rotation a 1-day buffer on each end. First, it's nice because if you're coming from a really intense ICU rotation, it's cool to have a breather before you come back to the department. And also, you may not have their schedule from their off-service rotation at the time you're making your schedule. So if you don't know what they're coming from, whether it's 24 or 32-hour call or an overnight rotation, it's best just to give a buffer zone. All right. Second, checking educational objectives. So part of your job in making a schedule is to make sure that everybody gets an even educational experience, right? So make sure they have a good mixture of different types of shifts, pediatrics, low and high acuity, especially if you have like a minor care or urgent care type area that you rotate through, community versus academic, and that overall workload is evenly distributed between residents in the same class. I will tell you that as a resident, I started to lean into this concept of balancing out different shifts. And now that I schedule for attendings, I do it even more meticulously. It really heads off a lot of the angst that you get from your colleagues if you can take the time up front to balance the shift distribution, because you're always going to have that one resident. We all know them. They get their schedule, they look at it, and then they count every single shift they have, and then they count all the shifts that their classmates have to see where they fit on that spectrum. And then they also count, okay, I have 6 pediatric shifts, but Joe has 4 and Sally has 8, and it just becomes a mess. So the closer, like I said, don't drive yourself mad over it, but definitely take a look at it and even it out the best you can. And then most importantly, look at wellness. So this is what I would do. I would look at the pattern of shifts for every individual resident. So once my schedule was created, I would look at Dr. Brown's shifts from beginning to end, and I would imagine that was my schedule. And I would live it in my mind, and I would say, where are the pain points in this schedule? What about this schedule is going to be tough? And then I would make some decisions about whether or not I could improve that pattern to improve the wellness of their schedule. Could I make a trade that would give them a schedule request I wasn't previously able to honor? Can I fix this anti-circadian pattern that came up? And then these are the pain points that I kind of picked out. So we talked already about this: absolute workload, imbalances in workload, make sure it's even as best you can. Shift distribution, same thing. Denied schedule requests. So we almost never had to deny a schedule request, but just know that if you have to deny a schedule request, you might get some frustration from that resident. So keep that in mind. These are 2 really important things I want you to pay attention to: the post-nights transition day off and the grand rounds day off. So it's going to be inevitable on your schedule that occasionally somebody's day off is going to fall on the grand rounds day. But if that person has all of their days off lining up with your grand rounds day, then they didn't really get a day off. So we would try to distribute that burden as best we can. We called it a GROMA. And then the same thing is for your post-nights transition. So if the only day off that person is getting is post-nights and then they go right back to days the next day, that's not really a day off. Even though it doesn't violate the duty hours law, it kind of violates the spirit of the duty hours law, which is that you need 24 hours of consecutive time off, but in reality, try to make that a calendar day. Weekends, again, pay attention to the distribution of off time and shifts on weekends and holidays. You'll probably have a system already for holidays, but you just want to make sure you're keeping track of that. And then the other thing I want to pull your attention to is that even though you can schedule a resident for 6 days on, 1 day off, 6 days on, that's super painful. We all know that that is a really, really tough schedule. So whenever I would see long stretches like that, I would try to break them up. All right. So I want to give you just a quick exercise. I think we have a little bit of time still. So I want you to take a look at the schedule. This is a 4-week block schedule. This resident is working 8-hour shifts. So the day shift is 7 to 3, the swing is 3 to 11, and the night is 11 to 7 a.m. In the chat, I want you to point out some places where you think this might be painful for this resident. So what about this schedule do you think might be harder to work? I'm going to give you just a couple seconds and then so that you can look at it, and then I'm going to back out of the share so I can take a look at the chat. All right. Let me see if I can pull up this chat. Perfect. Counters of the schedule are way more infuriating than the patient who clock watches for pain meds. I don't disagree. All right. Only one. Okay, so I'm seeing no full weekend off. Lots of nights and swings. Yes, and rough transition after that last night shift. Yep. Last week was a night to day. Absolutely. Day shifts on 3rd and 4th weeks. Yes, you guys totally nailed it. Okay. So those are the main things I picked out of this as well. Oh, let me get that chat out of here so you guys can see this. So that swing today, that's rough. It's not a deal breaker for sure, but it's rough. This definitely is tricky, this really quick turnaround. And then the other thing you guys picked up on is only 3 out of these 19 shifts are day shifts. So this resident is spending a ton of time working swings and night shifts. And I just want to bring swing shifts to your attention because I personally felt as a resident that swing shifts were some of the most disruptive to my social life. because you're technically working when everybody who's not a doctor or who works a 9 to 5 job is off. And so if you do a lot of those, you can start to feel really isolated from the people around you. So don't let the swing shifts kind of get away from you. They're a big factor, big impact on wellness. All right, check it twice yourself. And if apathy sets in, come back to it tomorrow. You all know, especially some of you who have sent me the shift admin help comments, you can spend a lot of time staring at a schedule. And I remember there were times when I was like, I cannot work on this trade anymore. I don't care. This schedule sucks, but I can't, like, I'm not going to fix it anymore. Then walk away, but come back to it. If you feel apathy about something that you know is going to be rough for one of your colleagues to work, come back to it tomorrow. That's why you got to give yourself plenty of time so that you can take breaks, come back to the schedule with fresh eyes. You're not always going to be able to make a perfect schedule. You're not going to make a perfect schedule for anybody, but giving it your best effort is key. Have at least one co-chief double check your work. So our situation in residency was that we would have, we would assign one class to each chief, and then we would all check over that class. And then my last thing is take a deep breath. Everybody has an opinion, and it's okay. You are going to get feedback about your schedule. You're going to overhear your classmate talking to your other classmate while you're all charting in the resident lounge about something that they don't like about their schedule. The truth is that, like, shift work is hard, and emergency medicine is hard, and it's going to be natural for those folks to be talking about their schedules and venting. That's natural. And not only that, but they don't know all of the things that you went through to make the schedule, right? They don't know all of the moving pieces necessarily. They don't know the schedule trades that you made maybe to get them a schedule request. It's natural just to think about how their individual schedule affects them without necessarily considering all of the things that you put into making the schedule. So when you hear that stuff, take a deep breath. Know that it's not personal to you. It's personal for them, but it's not personal to you. If you start to hear themes in feedback, listen to it. And if there's something that you think you can change about the wellness of the program or the way the schedule is made, do it. That's awesome. But try not to react with anger every time you hear someone say something detrimental about your schedule, because it's going to happen and it's universal. So in summary, prepare carefully. Don't violate your duty hours. Use a circadian progression with whatever you choose to do, without however you make your schedule. Check and double check your work and maintain and consider resident wellness, and you'll be very successful. So with that, I'll stop. And if anybody has questions for me, I am happy to field them, or if you need a snack or pee break, that's awesome too. But I really appreciate you having me here to talk with you today. I'll throw my email up in the chat so that for those of you who had questions about shift admin or just scheduling in general, feel free to email me. It's one of my favorite topics, so I'm happy to field them.
There honestly are probably few people in the world that can speak to that and actually honestly say that, but I do believe that about you, Dr. Betham. And as you sort of highlighted beautifully, this is a real, as you sort of labeled it, pain point for most residents. I'd love, actually, if you wouldn't mind, how did you approach the resident who perpetually had lots of schedule requests, right? Because it sounds like you were lucky, because a lot of people really embrace that a request off means someone else is working for you, but there's always that one person that doesn't understand. And did you have that person? And if so, how did you potentially deal with them?
We did not have anybody who we felt like overall was giving too many schedule requests. For sure, we would sometimes roll our eyes at a schedule request. But at the same time, like, what's important to you isn't necessarily what's important to your co-resident. So we try to take that with a grain of salt. I would say if you have a resident that is routinely requesting too many things, I would come back to them and say, hey, I appreciate that you have a lot going on. Unfortunately, just because of the number of shifts that need to be assigned this month, we're not going to be able to honor everything that you are requesting this month. So could you please give me a prioritized list? And that way you're getting their buy-in about what they want. And you're also giving them a little bit of a warning shot that they're probably not going to get everything. And I would say most people respond to that. Most people are like, okay, cool. these are the things that are most important to me. Let me highlight the things that I care the most about. And that's kind of a win-win for you because you know what to prioritize for them, but then you also give yourself the option to preserve some schedule requests and flexibility for other people. And then I would say if it becomes a really big problem, it's probably worth an in-person conversation about really how many schedule requests you can manage at a time. But I think for the most part, you'll find that people are pretty receptive to that.
Great. Any thoughts about, a lot of people incorporate vacation into their schedules in some way, shape, or form. Any thoughts on how to do that effectively in the context of scheduling an already busy, month?
The biggest thing I can say is when the block schedules are being made for your residents, you'll want to set some guidelines about how they should be distributed. So in our program, we were responsible for making our own block schedules, which was nice, but then we also had to keep it even. So we couldn't all 14 of us take vacation at the same time. And so that's going to be your first step, is to making sure that vacation is evenly spread out across the residency program. When we were using shift admin, we were using the algorithm to schedule shifts. So if you're on vacation, we would just mark you as being on vacation. You couldn't get assigned any shifts then. There are some considerations around the start and end of vacation that you can take into account. So if somebody has their vacation starts on a Monday, putting them in a night shift on Sunday night so that they're working until 7 a.m. the first day of their vacation is a pain point for many people. It was sometimes inevitable for us, especially on the edges of months. We couldn't always honor that, but we did our best to kind of keep an eye on those things. But yeah, I think really success with vacation starts at the beginning of the year and making sure that the class evenly distributes the vacation time across the year so that you don't have months where you have no PGY2s, for example, because that just doesn't work. And I did get a request to share the Google Doc that we use for schedule requests. So what I'll do is I will route that through Matt, because I think actually I do have all my old schedule request Google forms. So I'll show you, I'll send it to Dr. Stahl, and you have a way to disseminate that to folks? Perfect. Okay, I'll get that out to you guys.
Awesome. Well, yet another awesome talk. I certainly have learned some things. Thank God I don't do the schedule, but I am excited that there are people out there like you that really do care and make sure that it is as crafted perfectly as it could be. So thank you so much for your time. The residents are clearly, appreciative of your insights, because this is not an easy, I'll tell you guys, every year we have a challenge finding someone that gives an engaging and thoughtful talk about scheduling, because it's not exactly the sexiest topic that has ever been done. But I gotta say, I think Dr. Betham hit it out of the park for us this year. So we really appreciate her engagement, and thank you so much.